Right, good morning, welcome again. You're still watching your favorite program, favorite breakfast program, I must add, Wake Up Sierra Leone, live on the Africa Young Voices. You're watching us on TV, and you're also listening to us on radio on the 101.7 FM. My name is Victor Jones, and I'm here with Marina Terry. Now in this final segment this morning, we are going to, if you like, evaluate the country's healthcare system, successes, challenges, and the fight against coups, including the importance of the International Universal Health Coverage Day. Now, the Universal Health Coverage Day is an official United Nations designated annual observance held on December 12th every year to raise awareness generally about the need for strong and resilient health systems and the goal of providing quality, affordable health care for everyone, everywhere. Now, without financial hardship also. Now, in the studio this morning, we've been joined by the country's Minister of Health, Dr. Austin Demby, and Dr. Julius Spencer, who is a media practitioner and recently wrote an article titled Drug and Substance Abuse is an Old Age Problem in Sierra Leone. Also joined this morning is Ernest Reffel. Ernest is a ghetto reform activist and couch victims. All of them this morning will paint a picture for us about the country's health system. But good morning to all of you.
Good morning,
welcome
gentlemen.
to the program. I'll definitely begin with you, Doctor Demby, since it's
We
your...
have two doctors here.
Oh yeah, you know, it's a good thing actually.
Yeah.
Yeah, we are faced by two doctors this morning and a reformist in Studio 2. It's a rich conversation.
It is, absolutely.
But welcome, Dr. Demby. How do we stand generally in the health sector? I mean, there's been a lot of improvements, I would say, generally in the health sector, but prime us among those changes. Which are there? Which would you put attention on this one?
Well, thank you very much, and good morning to you and your viewers and listeners. We're in a very, very good place. Very good place because we just celebrated Universal Health Coverage Day. And for us, it's a day of reflection. It's a day of looking at health, not just from a clinician standpoint, but to look at a holistic view of the person's health. And we've been undergoing quite a revolution in this country, but I think people are not really aware of this revolution. Okay. Traditionally, people have been used to having disease programs, a malaria program, HIV program, a nutrition program, and a very, very dissonant, and very siloed approach to healthcare. But it's just one person you're looking at. And so what we're looking at now is client or patient-centered care that looks at the 360 around the patient. And when we say universal health coverage, we truly mean universal, which means everybody, ensuring that you're seeing everybody, the healthcare system sees everybody, and everybody sees themselves in the healthcare system. And the way we're approaching this is for you to see everybody, you take it in little bites. Okay. And for us, the bites are following the life stages approach. Starting with pregnancy, what do we do, or how are we managing the 350,000 to 450,000 pregnancies we have every year? How do you ensure that each and every pregnant woman is seen as an individual and their health is taken care of, helping them for their own health as well as the health of their unborn child, and allowing or supporting a safe delivery of the baby. When the baby is delivered, we have an obligation to not just focus on survival these days, but how do you make sure that between 0 months and 60 months that the baby thrives? And so we're looking at all of the interventions that you do for the baby till they're ready for school. Till they go to school, when they're in school, how do you provide school health that will be able to support them as they learn, till they become adolescents, till they become adults and senior citizens. So from pregnancy all the way to senior citizens, we're having a holistic view of healthcare. This has been adopted globally now, but nobody has seen it in practice. They're coming to Sierra Leone to see this work. So, I mean, if you begin to see some of the indicators, just looking at the pregnancy, the kind of dramatic gains we've seen there, it's not seen anywhere else in the world. The kinds of improvements we see in, for 0 to 6 months, it's not been seen anywhere else in the world. And so on and so forth. So again, there are changes that are occurring, and some of them are not very, very visible right away. But you just give us a little time, you begin to see the results objectively and actually.
When you say little time, I mean, you have basically 2 more years, you know, to clock
No,
out.
we're not, man, come on.
Well, the governance is continuing to go.
We're not looking at 2 years. We're looking at Sierra Leone. Now, your healthcare doesn't stop in year 2. Yeah? We're looking at the whole country, 8.5 million of us. We're looking at our healthcare. In fact, my planning, or ministry's planning these days, is to look at what we do for everybody over the next 5 years as we plan for 2030 and beyond. So it's not political, it is national.
You know, I'm sure you're overwhelmed at the moment. I mean, the biggest elephant in the room right now is the Kush fight, you know, Kushdemic, which is ravaging the lives of a lot of youth. I'm not sure you've read Doctor's piece on it, which he did recently.
I think it's really important.
Have you read it?
Yes, it's really important that, you know, healthcare is not a single entity. Yeah, it's not a single entity. If we focus on the Kush situation now, which is a serious problem, and try to address it, and we don't address immunization, we don't address HIV issues, we don't address nutrition issues, we don't address infectious disease issues, the whole system will collapse. So it's having the balance right as we look at all of these issues. Yesterday, we declared the Mpox outbreak over in Sierra Leone.
We'll come to that actually.
Yeah, we'll definitely come to
Listen, I'm just saying, it's not an accident. It's a deliberate action of the whole country to get to that level.
But someone would say it's dragged on for so long. Even vaccination was a problem actually, because I wanted to ask actually if we are really free from Mpox, although it has been declared, you know, over.
You know, people laid their lives to protect others. Yeah. And the good thing about public health is it's a focus on prevention. Yeah. When you had Ebola here, 14,000 people were infected, 4,000 died. Yeah? For us to have a situation here where you have 5,500 infections with only 60 deaths, even one death is one death too many. Yeah? It's not by accident. There is a lot of work that went into it. So the fact that we've declared it over, it means that you're following objective global standards. If you look in the whole country with active surveillance, for 2 incubation periods, which is 21 days each, if you go for 2 incubation periods without seeing a single case, it means it's over. What we need to do now is to consolidate our borders to ensure that we don't introduce it. And even if we introduce it, we'll be able to quash it right away.
Let's usher in Dr. Julius Spencer. Sorry, I just wanted to say Dr. Austin Demby. But good morning again and welcome to the program. Your article argues that, you know, the drug and substance abuse is an old age problem in Sierra Leone. What historical pattern supports this claim?
Well, drug and substance abuse started long ago. It did not start 5 years ago, 10 years ago, not even 20 years ago. But it got worse during Civil War. Those who are old enough to remember, during the Civil War, hard drugs played a major role. Whether it was the rebels or even regular soldiers, many people went into drug use. The rebels were said to be drug crazed at times. So they used a lot of drugs And after the war, we had the DDR program, the mobilization, disarmament, demobilization, and reintegration program. But two things it did not do. It did not deal with trauma, and it did not deal with drug abuse. So those young men and women who had gotten introduced to drugs, it had become a way of life for them, went out into the communities, and it spread. Now, it was marijuana, then cocaine, heroin, LSD, these amphetamines, etc., etc. In the 90s, when I was in Pademba Road prison, drugs were getting in there. Then it was Valium. Now it's Tramadol. So things have changed. Now we got the introduction of Kush. Kush is a synthetic drug. And it was being imported initially. And then some clever, they won't call them, they are not medical scientists, clever, they are not chemists, exactly, chemists decided that they could do it here. Then the components started coming. And they started adding all kinds of toxic substances to it. So, and it was cheaper. It had greater effect than marijuana, which lots of young people were using. It gave you a bigger bang, as they would call it. It was cheaper. So a lot of these people who were involved in drugs migrated to Kush, not knowing its level of toxicity. Now, what is with the effect we see now is that it is killing many young people because they are being killed by these toxic substances.
Dr. Spencer, why do you think this particular issue of Kush has escalated now to crisis level?
Because, okay, my next article will deal with what we need to do from a social perspective. There are many problems in Sierra Leone. There has been a breakdown of parenting. When I was young, when I was bringing up my kids, most parents knew what their children were doing. They monitored their children, monitored their schoolwork. Nowadays, the majority of parents don't know what their children are doing. They leave home, everybody's on their own. Parents leave home at times before the kids even go to school. They don't check out on them in school. They don't know what they're doing. Kids come home having bought things that the parents did not buy for them. No questions asked. In fact, some people encourage their girls to bring things home when they are not working. So there's been a breakdown of parenting. That's one. There are a lot of social pressures. You have people, young people go to university, graduate, they can't get jobs. Even though many of them drop out of school, their parents cannot afford to pay their fees, they end up getting into all kinds of antisocial activity. So all of these factors, and many of these young people are frustrated. Drugs are like a quick fix, a way of forgetting about the pressures that you have. Temporary, of course, but when you get hooked on it, and Kush is extremely addictive. It's extremely addictive. As soon as you get hooked on it, you find it almost impossible to leave it. That's why you have these young people, they have these sores, they are complaining, somebody should help them to stop using Kush, but they cannot help themselves. So it has become an epidemic as far as I'm concerned.
Okay.
And it's killing young people in droves. You see corpses on the streets that we didn't used to see in the past. Driving along the streets, at times you see a corpse here. You go somewhere, you see a corpse there. You see people struggling to stay alive. And these are people that are known in those communities. So it has reached this point, one, because of the social issues, breakdown of parenting, all kinds of social pressures, poverty levels, etc. And then also, it is cheap. It is cheap. That is one of the major factors. It is cheap to get, cheaper than the other hard drugs like cocaine and heroin, etc., etc. And it gives you more of a bang, as they say. You smoke kush, it is more, you feel higher than if you smoke marijuana.
Before we get the Minister of Health to maybe add or respond to what you're saying, do you believe the state responded too late to the kush epidemic?
Well, the state responded over a year ago when the president declared a state of emergency. Now, what we all need to recognize is that this fight is very capital intensive. There are things that you have to take a holistic approach, which I believe the government is trying to do. There's the treatment for those who are already addicted. There's the law enforcement to try to break the supply chain. But there is also what needs to be done to reduce the demand, because it's a matter of demand and supply. There is a demand because many people are now using it, not just kush, all kinds of drugs. And so people are looking for ways to make money. Just like during the war, people made money out of the war. Why many people are dying, some people are making money. It's the same thing that's happening now. So unless the demand is reduced, we will continue to see it. We may get rid of kush. Something else will take its place. And drug abuse is something that is extremely difficult to get rid of. I don't think any country in the world has succeeded 100%. America has not succeeded. Americans are being killed by fentanyl. Again, a toxic substance. But for them, it's not so much being killed by the toxicity. A lot of it is overdose. Lots of Americans are dying, well, people in America, they may not all be America, dying. And that is why the president now is adopting this policy where they're even attacking boats, which they claim are taking drugs into America. So it is a worldwide problem. It's a worldwide problem, and anybody who is blaming this government as the one that has caused what we are doing now is missing the point. It goes beyond this government.
Okay. Mr. Minister, quickly before you maybe give your response to that, is the current response more punitive or is it health-centered, and why?
I think, as Dr. Spencer rightly said, you cannot deal with one aspect of the problem in isolation. This is something that requires a complete holistic societal response. At times I bristle a lot when the focus is on treatment or how have you created places to treat people. We're never going to succeed if we don't stop the supply. All of the active ingredients around this are imported. If we cannot stop these imported products coming in, it's like mopping the floor when the tap is open. So we have to have a very, very aggressive law enforcement component that looks at identifying people who are importing the products, people who are manufacturing the products, people who are distributing the products. As we do this, we have to look at the societal component of it. What's the role of parents? What's the role of teachers? What's the role of civil society? What's the role of ourselves in preventing this? And then you come to the medical is a safety net. So if you have like some of the psychosocial support for families or individuals that are suffering from this, the issue now is how do you bring them into care? If somebody has a sore, you go and bandage the sore without addressing the drug use issues, you're literally wasting everybody's time. So finding a way where you could combine all of these, this is what the government is trying to do. Aggressive law enforcement, strong social support services with having rehab centers. We have rehab centers in Freetown, in Daru, and I think they're building one in Bombalay as well. And when you have extreme cases with psychotic components, you have the Kisi Mental Hospital that's there with about 60 beds to manage much more complex cases. But it's a combination of all of these things.
They're overwhelmed. The doctor was here the last time.
how
In charge of the mental home.
How could you be overwhelmed? It's our collective responsibility. When you say you're overwhelmed, there's a tendency to give up. We cannot. We
But we don't
cannot
have the
because
resources,
everybody.
that's the thing. The resources are there, then they will perform.
Look, again, I think that's one of the mistakes.
They are stretched thin.
That's one of the mistakes that we make, that we blame all of this on resources. We cannot buy our way out of this. Even if you have a ton of money dedicated to this, without strict law enforcement, without social support services, without family-oriented, I need to pay money to mothers to know where their children are. You need to pay money to parents to know where their children are. Again, I think the resources, the financial resources are important, yeah, but they're not at all. It's a combination of all of these factors, and what the government is doing is to bring all of these pieces together. And what happens by the declaration of an emergency allows you to boost the effort. So you don't have enough resources, financial resources for everything, but you could have optimization of the resources that you have to be able to do what you need to do.
We saw how, energetic, the health sector was fighting against Mpox, which was declared over yesterday. Why couldn't, your ministry put the same efforts, strength and power in fighting Kush in Sierra Leone?
But you heard what I said.
This is but most of these holding centers even,
this is
the
not a
resources are stretched
medical
thin.
issue. It's
Doctor,
a
you want to come in?
Social issues.
I understand. Dr. Spencer.
I agree with the minister up to a point, but resources are important, are very important, because even on the social issues, public engagement, public enlightenment, education, sensitization, right down to community level needs to happen. Resources are needed for that. Because if you take Ebola, I was part of the Ebola fight. He himself was part of the Ebola fight. He was with CDC then. And what we did that helped us begin to turn the curve was community engagement. When the community was engaged and they understood the issues and they themselves took action, that's when it started turning. Even burial, for example. Burial. The way people were being buried initially, it was against tradition. People believed they should wash dead bodies. It took a while for them to accept that you cannot go wash somebody who's died from Ebola. So there has to be engagement, sustained engagement at that level. A number of things need to happen. One, those children and young people that have not yet got involved in drugs need to be educated about the dangers. How can we ensure that they don't start? Because when they start, it is a slippery slope. So they are the children. They are the communities. What can communities do? The minister is right. It's not the Ministry of Health that will be able to do all of that. What can communities do? A lot of communities are at a loss. They see their children being affected. They don't know what to do. So how can we engage communities so that they understand what the problem is and know what to do, whether it's regulation they put in place, how do they deal with these issues? People selling drugs are known. They are known in all the communities where they sell the drugs. So what can these people do to help law enforcement to deal with these people? We hear a lot of talk about those who are importing these things into the country, but let's also not forget that drug dealers are very powerful. Not the small-time ones that are selling on the streets, so the ones who employ those or sell to them are powerful people because they always have a lot of money. And in Sierra Leone, we all know now, our capacity to do anything for money. So they may be able to bribe their way and get even law enforcement officers on their side. So there has to be engagement at the top level to monitor what is going on. That is for the law enforcement side. But the community level, we need to be able to engage communities at grassroots level, get communities involved, let parents understand what they need to do. For most parents, it's not that they don't want to look after their children. They are at a loss nowadays. The way life is in this country, not just in this country, across the world now, parents are tied up trying to make a living. They cannot give enough time to their children. So we need to let them understand the dangers that their children are facing if they do not pay more attention to their children, and encourage them to do that. So a lot of work needs to be done on the community engagement and sensitization level, because I say again, it is a matter of demand and supply. If the demand exists, there will always be supply. No matter what you do, you may arrest all the drug dealers now, get rid of kush, something else will take its place. Because there is a demand for drugs, hard drugs, and people have gotten used to it. If we do not deal with that side, drug abuse will continue.
Okay, and let's join Prince Josh, who is in our studio too. Good morning, and thanks for being with us this morning. Help us understand at that particular point in time in your life, what made Kush attractive?
Thank you for the privilege of having me on your studio. Well, I started taking Kush in 2016. It was something I had wanted to test, to have an experience about it. Because I have always been...
Can you speak a bit louder,
Louder.
Hans,
I have
please?
always been a
Yeah.
ghetto advocate.
Okay.
Yearning to understand the intricacies in the ghetto regarding drugs, social issues, and the holistic aspect that gets people clumped into ghetto environment. So I try to have an experience of push, and after I started it in 2016, I stopped immediately. So it was until late 2018 going to 2019 when it became my life beat. Then I started smoking it again, so I became addicted to the process until late last year when I got myself out of the process. So in a nutshell, it was something I had wanted to try, but I got trapped with the two stories of addiction. So that was what happened.
And how did that in any way affect your health, your mental well-being, your family, and so to speak?
To start with, my health was under threat. I'm about to say that. But it was not just about my health. My applicability to be a progressive person was really halted. I was not able to continue my college. I was into some works. Then everything became sort of disturbed and disrupted for me. I stopped everything really from college. My engagement with other organizations that I was working with was not really, so I had to stop everything. So on that note, I got to, have a series of bad experiences.
Just been told, sorry to interject you, Ernest, been told that your microphone has some sort of problem. We'll sort it out actually, we'll get back to you. But in the meantime, let's come back to Dr. Demby. You've listened to, Dr. Spence. His case is that resources are important too here, because to conduct community mobilization, engaging grassroots people, involves money actually.
Yes, yes.
So however you look at it, finance is quite crucial.
Finance is very, very crucial to everything. And I think Dr. Spence and I were very active during the Ebola outbreak here. During the Ebola outbreak, there was the whole world was scared. And people were opening their purses. That millions, literally millions and millions of dollars came into the coffers here to try to arrest the situation and shut the outbreak down. The world has changed. Yeah. For example, with the Mpox, the Sierra Leone government was the biggest contributor to the response. So for me, it's not that resources are only, resources are very, very important pieces. They're needed. What I advocate for is to have a clear plan of what you want to do, what you want to accomplish. If you're clear about that, then the next critical question is, what resources will be needed to accomplish what you want to accomplish? But in a lot of cases, what I hear is money, 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 money. And these days people are asking, what is my money buying? What am I paying for? So again, for this Mpox outbreak, we went everywhere. We knocked on everybody's doors and people were like, sorry, we're busy. Sorry, we don't have the resources. The US had minimized their input. All of the other bilaterals had minimized their input. We made a strong business case to the Ministry of Finance, and with approval from the presidency, we were able to scramble and raise $1.7 million. That is what we used to open up the facilities here in Freetown and in the provinces as well, because it meant a radical shift in strategy. Instead of treating people and sending them back into the community, we opted to extract them from the community and bring them into a facility where you take good care of them as you look to mop up behind them. So the strategy is really more important at the outset than the resources, because if you just throw money at it, you'll be throwing money at the wrong things. So let us be very clear what we want to do. I mean, as Dr. Spencer rightly said, let's tackle the supply side. Take good care of it. Let's look at the social component of it and cost it. Some of it requires money, some of it requires commitment. Let's look at the medical safety net component of it. What's required? Some of it requires money, some of it requires technical capabilities. So again, it's a much more rounded, nuanced view of not just money, 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 but what we want to do and what resources do we need to meet what we want to do.
Of course, you know, there's so many things we should be happy about, and one of which has to do with, you know, the declaration of the Mpox outbreak being come to an end. Now, at what point did the ministry realize that, you know, the Mpox required an emergency level response?
So, if you remember, the first case was detected on the 9th of January. Actually, there are two cases. That evening, we declared an emergency. Sorry, and a lot of people are, why are you declaring an emergency for two cases? But we knew where this was going, that it required everybody coming together and putting our efforts to them. What happened was, when we came together, there's several components that need to be in place, like we learned from Ebola, that you cannot do all of this from a medical standpoint. The community, the society must believe in what you're doing and must actively participate in the solutions. And the expert, the rule of thumb approach that we had was, even a simple crocro. A simple crocro, you would always see this crocro every now and again. You know, I would just give them mess and send and go in the community. That's what we did, the initial rule of thumb. That's the importance of data. We saw that for every one person that was diagnosed and treated and sent back in the community, 2 or 3 more people were infected that way. So we had to radically change the approach to it. We got advice from a lot of international experts, and we said, we're not going to listen to any expert. We're going to listen to the data. What is our local data and our local context telling us? And we changed. And when we changed, you saw the number of cases falling.
186,000 vaccinated and 60 deaths. What may have possibly led to the deaths of those 60 people?
Again, these are medical conditions, so you have to be mindful about people's privacy. Okay. But this is a virus, you know, and when people have other underlying conditions, the virus is a lot more aggressive. So most of the 60 people that unfortunately we lost had underlying medical illnesses. And what the Mpox did was just aggressively make it worse, because it's a virus.
Jones did mention or asked a very important question about, now, you know, we've declared the end of the mpox outbreak and stuff like that. But let's say, for instance, it resurfaces. Are we strong at the moment in terms of addressing it? Let's say, it's resurfaced at any given point in time.
Yeah. I mean, there are active cases in Liberia, in Guinea. There are active cases all over the continent. So we have an active surveillance system throughout the country, and they're looking for any case. So yesterday, I don't know if your media house was there, but after the declaration, we went and commissioned the Watch Station. The Watch Station is an active real-time center over at Cockrell. And we have the same thing over in Port Loko, in McKinney, in Bow, and in Kenema. And throughout the whole network, they are actively looking for any case. Now we know the formula. We know the formula for it is, if the community is with us, the chiefs, civil society, local people are with us to help identify cases. We will extract those cases. We will bring them into a medical facility. We have all of the tools to manage it. And at the same time, we still have over 80,000 vaccines left that we could use to inundate the space where this individual case came from. So again, it's not going to stop this from coming, but we'll do everything to prevent it. But if it shows up again, we're better prepared to respond to it.
Okay.
Let's hear from Ernest. We apologize indeed. Earlier on, your microphone was a bit glitchy. You've listened to, Dr. Dembi. You've also had the privilege to listen to Dr. Spencer. From your standpoint, you were once a user, right? You were a user of the substance. So how do you think, honestly, we can tackle this problem? And from your perspective as someone who has used before.
I think I would advise an integrated collaboration from engaging from communities.
Okay.
It has to start with the individual, maybe in the habits, you have to give up on maybe practicing and testing drugs. You have to be determined you have to do that with the help of the society. Then the government can come in. They are just there as external factors, so to speak, to aid your recovery, because they themselves, these are embarrassment to the government. I would like to say that. And they are not welcoming the area we cry about the presence of drugs in this country under their dispensation. So I believe with the declaration of emergency sometimes last year by the president and the executive government, that was a wake-up call. But because we were politicizing it, asking for the antecedents of when push has been there, whether it was during the APC or SFP, this was where we missed the point of fighting it. So until the repercussions became intensified, that was not looking for politics or tribe or religion. We have it making effect on all sectors of the country. So I believe it has to be a multi-sectorial approach, and it has to actually be sincere and genuinely confronted with nationalistic mindsets. Because until we have these things, because those people who are dealing with drugs, that is patriotic on their part. Because there are other things they could do for us, they could trade in. We have laws that are making this practice so illegal. But they should their practice is through compromise and corruption. So I don't actually agree with the elder and senior panelists who have at least said the obvious that there should be a collaborative system towards this. We've seen the president making outlay of series of guidelines, series of pronouncements ranging from special forms, special courts, practice procedures or practice direction in legal ambit, enforcement of legislative and judiciary reforms. All of these things are to aid the fight against push. And we've seen as of 1st of December the outlay of the practice direction for the Chief Justice that speaks on how dealing with push matters should be handled in response to the 2008 Act of the National Drug Law Enforcement Agency as it has been established. So it is a holistic approach that the community, the society, and the nation at large has to come on board, regardless of your political ideology, your regional or your color of orientation, because it borders on life, it borders those who are actually at the mercy of the elite, and we are the futures that the country is looking up to pick up on leadership and development.
Alice, there's a central message here, which is to tackle the supply chain of drugs, you know, across Sierra Leone generally. Now, you could be quite instrumental in this. Paint a graphic picture for us, if you would. You were once a user. Why did you used to get drugs? Where did you buy your drugs from? From community level? You know the people around who sell it, don't you?
Yeah, I used to know them, but I don't know them anymore. But I know that...
You've forgotten where they are.
Actually, I'm only living in the community where I used to take this drug.
Okay.
I was at 3 plants as well, but since I went to do my rehabilitation, when I came back, I changed my environment. But I know you can get them from police.
Or you can buy drugs from the police.
You don't have to buy it. I was very influential in the ghetto. They could call me, please come and have a taste of this. I was like a lab.
The police officers, you mean?
Yeah. Huh?
You used to buy drugs from the police officers, you said?
They could give me, not necessarily buy it, but they have to possess it. They could seize it from the raid.
And they sell it to you?
They want to sell it to someone so they can call me and say, please access this particular drug. So I was like, elaborating.
This is a major revelation, actually. Honest, you're telling us this morning.
I made this revelation known to the truth media. Then I was on some point here.
Yeah.
Just to be clear again, Alice, just so I get the picture correctly, you're telling us this morning that the police can actually resell these drugs to people, drugs they've confiscated from people who sell them.
Yes,
They sell them back to the market.
In fact, yes.
Wow.
They used to trade in it. You know, that used to happen. They could seize it from Eastern and sell it back.
Indulge us a bit in this fishy dealing, please, if you can. And I know you don't have much time, actually, but I mean, how do they do this? I mean, because these are uniformed men and women, people who've entrusted, you know, huge responsibility on their shoulders to keep us safe in Sierra Leone. These are the people who are selling drugs. Do they meet you? Do they go to your house to sell this thing? Do they call you on the phone? Do they have bonners where they do their communication? How do they do it? Can you describe the operation for us just briefly, please, if you can remember anything?
So, for the purposes of time, in my life, I was actually on the rampage. I was not having a fixer home, you know, I was just on the street here, in the sense of doing my ghetto research. So I would meet them, or they would meet me at a certain, you know, drug peddling spot. Then they have to call me, Prince, who do you know deal with the drug? Sometimes when they come around, if you are there for game, others will run away, but I will not run, I will stay in. They will say, come here, who are you? I will speak to them. I'm a student, this is what I'm doing research. They ask me, do you take drugs? I say, yes, I take push. Okay, come to the car. We have this, we seized it from somewhere at Eastern. Do you know who sells this thing? Then I will ask them for confidentiality, so I will direct them to one of the peddlers. They will do their transaction. Then sometimes they even make themselves clients and, you know, retailers. That's
the Lord of mercy.
So, the one reason you shouldn't be shocked seeing revelations where police have been arrested and being brought for dealing with drugs. Some who seize these things, take them at their houses instead of taking them to the police station for evidence. So, I'm talking out of experience, which is an organic experience that I've had with getting on the police.
I'm sure there's enough experience, actually, honest. Yes,
Prince, help us understand something, because honestly speaking, we've seen victims who have been users or stuff like that. But what's really motivates you to speak out? Because there are a lot of stigma around this, you know, for someone who might have been a user, definitely wouldn't want to come public and have such conversation or talks. What motivates you really to speak out?
Well, I started this whole advocacy all the way in 2002. I'm in 2022, sorry, it's SMBC. By then I was in the practice. I was making an awareness around the abortion that eventually lead us to where we are, society, security, and all those sorts. So for me, it was a decision I made that having gone through this thing, the only thing that will satisfy my quest or my credibility is to come out and speak against, you know, the drug, devoid of the stigma that will be attached to me. Maybe I would have friends with whom I have attended college, they might have been successful in their own area. But I choose to be an advocate and a sensitizer of this same job I have practiced, so to save lives. So I was influenced by the positive mindset that, I have to make this contribution to be a positive influence within the ghetto and those who are addicts. So that was what actually motivated me, and it was a national call I felt I'm obliged to do. It was not for me to be silent, having an experience with the drug.
Apologies, we tend to be having issues with your microphone, but let's come to our main studio.
Yeah, and it was been quite crucial actually in his submission, actually, that it's the very police officers who are actually selling these drugs to people. I mean, it's unfortunate we couldn't quite hear, but Dr. Spencer, you wanted to...
Yeah.
You are surprised when he said that.
I am truly surprised, Doctor.
It is not secret. It is not secret. I told you that even in prison, drugs were getting in there long ago. Long ago. And I mentioned the fact of corruption. People want to make money by all means. So police officers, not all, some, probably a few of them, they go on raids. Even with marijuana, it used to happen. They go on raids, they seize, they hand over some, the rest they keep and sell themselves. Some of them are using the drugs themselves. So Kush is no different. It's the same thing. And as he said, you had police officers being arrested for being in possession or using Kush. So it cuts across. Now, the major problem we have here is not just law enforcement. Law enforcement, yes. As I said, and I say again, demand. If the demand exists, there will always be supply. If not these ones doing it now, others will get into it, as long as there is a demand. So we need to address the demand side. Now, if we take what is happening even in the ghettos, young people getting into it, some fortunate ones getting out of it. You know, when I was a teenager in university, I smoked jamba. Actually, all of us did. But some of us, it was very temporary. For whatever reason, whether it is our own psychological makeup, whatever the reason, we didn't last long in it. Some stayed with it to their old age. So it is, even with Kush, your own psychological makeup, your own physical makeup could help you to extricate yourself. The majority will not be able to extricate themselves because this drug is extremely addictive, which is why, for me, we need to target those who have not yet gotten involved in it, to try to prevent them from getting into it. And if we take the law enforcement, you know, and we'll talk about social mobilization. During Ebola, I was involved. We did this social mobilization. During COVID, I said at the time that COVID was the most difficult task that I ever had to work on as far as communication was concerned. Because when it came, people were scared. So you tell them, wash your hands, do this. Everybody had buckets outside. They were washing their hands, doing everything. When they realized that it was not killing people as Ebola had done, people relaxed. Wear masks. Even in Parliament, people were not wearing masks. So we were fortunate, I believe, as far as COVID was concerned, in that perhaps the virus that came here was not as virulent as the ones that went to the West. Or maybe our constitution made us more resistant. I don't know what it was. But what was predicted in terms of the number of people who die in Africa did not happen. Now, we set up systems with Ebola. After Ebola, everything collapsed. COVID, the effort was to set up systems that would outlast the disease and would be in place if we encounter any other kind of epidemic. It was during COVID that the National Health Agency idea came to being, and it was the moves were taken to set it up. Now it's been established, and it is doing good work. Those systems, community level engagement, the minister mentioned the MPOX, what they did with communities. I think the same systems need to be used for this Kush. so that communities can be engaged. We set up mechanisms for communication at village level. We had village heads, etc., etc. We had communication teams that were working with them. We set up systems. I think those systems still exist. They need to be reactivated if they have not yet been reactivated. If we recognize the importance of the social mobilization effort, then all of those will be mobilized. Some resources, I believe some resources are being put there, otherwise one would say that the government doesn't know what it is doing. But I believe resources are being put there. Maybe more attention should be paid there. Law enforcement, social mobilization. Treatment, yes, for those who are already addicted, to try to solve their problem. But for me, the two most important aspects that need to be dealt with are the law enforcement and the social mobilization. One, to try to break the chain of supply, and then to prevent people from getting into it and get communities involved to be able to deal with the issue at community level. If we don't do that, we are wasting time.
Mr. Minister, you've heard from the young man yourself and also Dr. Spencer here. How do we go about addressing this issue?
He's a brave guy, and you know, we tip our hat to her, because quite frankly, there's so much stigma associated with this, and so to be bold and come and state what it is, not for yourself now, but for the rest of humanity in Sierra Leone, is a laudable gesture. One aspect of this that perhaps I haven't spent enough time on is the rehabilitation component. So it's not a single event. Somebody has a sore, you go put a Band-Aid on it. First, you have to convince this person to come into a facility where they're mentally, socially, psychologically working with them over a period of time. And it's remarkable when people come out of these programs how different they are from when they went in. And now they're graduating, hundreds of them, through the Ministry of Social Welfare. They're coming out as ambassadors. They're going back to school. They're going back to colleges. They're getting job creations for them. They're getting distractions so they don't get back to where they were before. So it's a process. Again, it's resource intensive, but as you rightly said, we have to bring the community. We have to bring everybody in there. Now, what these guys are doing, some of the people who are coming back from these rehabilitation centers, they're getting us to where the sources of these products are. They're getting us to so some of the mega rates that you're seeing, the kind of people having thousands and thousands of kush packets in there, it's because somebody is given the intelligence that allows people to go there. So with law enforcement, I know he indicated some of the corrupt police officers, but let us not paint this institution with one brush. There are good people there who are doing their very, very best.
Not all of them.
There are a few corrupt ones in there. We need to identify them. We need to expunge them. But this is a battle we could win. This is a battle we could win. And again, I think we could say nobody has ever won this. But you know, Sierra Leone is a resilient country. When we set our hearts to something, when you bring everybody together, it's a small country, 8.5 million people, 16 districts, 6 hours east to west, not to south. We could fix this. You know, so I'm very, very confident that with a rallying cry and what the president is saying, you know, the president is not going to fix this himself. What he's saying, let us all work together. Law enforcement, social services, communities, health. Let us all work together. And actually, the numeracy around this is really quite critical. How do you begin to count and be able to see how many you're preventing, how many you're treating, how many you're graduating, and ensuring that we're keeping track of the progresses that we're making. So I think it's doable. Again, as we're coming to the end of the year and the start of a new year, this is a point in time where we could make our recommitment to our nation.
You know, I wanted to draw your attention to the Amnesty International's report as well on health. They highlighted several issues actually: maternal health access gap, you know, despite formal policies for free care. They also said gender inequality and discrimination are rife, affecting health outcomes. They also said weak mental health services. So things we've been discussing this morning, long-standing advocacy for accountability, legal reforms around health access and all of these things. Have you've read the report?
So it's the most, okay, I have to be diplomatic here. But you know, some of these journalists come out with sensationalism.
Amnesty
They're talking about-
International?
Yes.
Okay.
They're talking about obstetric violence and all of that, you know. First, they come in, you have international protocols for conducting a study. First, you need to have statistical power to allow you to extrapolate your findings. You have to be able to overcome biases in your questioning. You have to be able to have the analytics that tells you what you're seeing. If somebody comes in, just 1 minute, if somebody comes in, takes a camera and goes to Bome, takes a picture, goes down to the bay and takes another picture, and then goes, Sierra Leone is the filthiest place in the world. It will be factually correct when they talk about the images, but wrong when they extrapolate it to a nation. So that's what that journalist did. They broke all of the rules.
So you're saying
of
that the
dealing with
Amnesty
human
International
subject.
report is flawed?
It is fundamentally flawed. I'm
And I hope
sorry.
you know that Amnesty International is one of the most credible, international organizations when it comes to these
You're
things.
giving them too much regard and respect.
You
When
feel
they
so?
come to our country, there are rules. It's not even our country. Anywhere in the world you go to, there are rules.
Okay.
When these rules are broken, look, we're not children, we're able to challenge them. Look at this Mpox outbreak. Everybody told us what to do. Everybody told us and they were wrong. We looked at the data and we figured out what we need to do, and when we did what we need to do, we got it right. Some of us have worked in the global stage, so we're not intimidated by the name Amnesty International or whatever you call yourself. There are international guidelines, international standards that you adhere to. There are interpretations of data that allows you to extrapolate or not extrapolate. You could make comments. They didn't even consult with the ministry to provide context for what they're saying. They just went out there and started making pronouncements. And they had some few people who, I'm afraid, this did not take a moment to look at the interrogative component of what they were saying and just bought it wholesale. We don't buy wholesale. We look at the analytics.
Before we quickly have Dr. Spencer to respond, Dr. Ostendembi, what immediate policy shift would you prioritize if given additional resources?
So, look, as I said before, the global financial landscape is changing. It's changing dramatically. Now what we're saying, instead of people coming in here and dictating what to do in the health sector in our country, dictating where to go, we have a national vision and a national plan. And what we're doing now, again, this is a buzz phrase that's happening all over the world. All of the other ministers are adopting it. We're looking at 4 things. We'll call it 4 A's. We have a clear vision of what we want to do. We want everybody and anybody who comes in here to align with us, to be able to do what we want to do. We want them to accompany us. We're in a hurry. We want accelerated pace. We're looking at mutual accountability. For us, we've said, we're very clear. We're looking at health following the life stages approach. We're looking at health, looking at universal health coverage. We're looking at health with the focus on 0 preventable maternal deaths, 0 preventable child deaths, 0 zero-dose children. We're looking at primary health care by taking health care as close to the people as possible. We're looking at secondary and tertiary care with our hospitals as safety nets when you have breakthrough in the primary healthcare system. We're having referral networks. We're also establishing health security, which is what the National Public Health Agency is all about. So we have a plan, we have a vision, we have a direction. And I think what we're saying is people like Amnesty International and everybody else, they need to come and see what we're doing and align with what we're doing. As we speak, we're waiting for the president to make a major announcement because
About what?
the World Bank, WHO, government of Japan, we've all come together to develop a new national compact. A major direction. Again, I don't want to steal the president's thunder, but just
Okay.
begin to look out. Even with the U.S. government, I mean, what they've been doing before, they've agreed that no, we have to change and focus on what the country wants to do and how the country wants to do it. We'll make an announcement fairly soon. So in terms of priorities, our priority is to change healthcare delivery, focusing on primary healthcare, looking at quality healthcare service as close to the people as possible with built-up secondary and tertiary care, referral networks, and health security.
Okay, let's have your response. Yeah.
I'm not responding.
Okay,
As a
your
minister,
own
I'm not-
submission.
I'm not a medical practitioner. I'm not involved in the health sector. But I'm a media practitioner. And, you know, when you're at a certain, I've been a minister myself. When you're at a certain level, there are things that don't reach you. Things happen on the ground which you probably don't know and will not know because those who are supposed to give you that information probably do not give you the information. Now, I know people who have tried to access health facilities, and yes, the government has in place good policies, programs, etc. But when you get down there, most of the medical practitioners are making money. People go for services and they charge them. Not officially, unofficially, people have to pay. I know people who've gone there, whether it's the PCMH or whether it's Komon-Tok or wherever, and people are just making money. It is almost as if they are those who are in there who are being paid salaries to do certain jobs, many of them are just using it as their own private practice. And so perhaps what the minister or the ministry can do, and it is not just the practitioners down there, it goes up to ministry level, to some level. There is some kind of collaboration. So perhaps what the minister can do, you know, we from the journalism perspective, we will do investigative reports, undercover reports. Perhaps you can get some secret people who go there and just go as normal people to access the services and let them come and tell you their experiences. You'll be surprised at what some people go through.
Okay, quickly.
So, thank you very much, Dr. Spencer. You know, they say you're not a mirror to yourself. You don't see yourself. It's what other people say. We're a service-oriented entity. One of the things that, first, you know, without the resources, the basic resources, you're not going to be able to do anything. And I told you just what's happening globally. I am trying to mend that. But as you're mending that, you really need to go down and see what's happening on the ground. So that's what we're intensifying now. We have what we call Spotlight. We went to Moyamba district and just completely turned it upside down. Look at every aspect, from the hospital, from the staffing, from the finances, from the pharmacy, all of these services. We're going to go district by district and to be able to interrogate it. And what we're doing now is we go in digital. We go into digital hubs so that you know exactly what supplies are going in there. It's called M-Supply. And at the district level, we know how much is there in any one facility at any particular time. On the human resource part, this is our biggest weakness, our biggest Achilles heel. There are lots of people who are pin-coded. There are lots of people who are volunteers, so-called volunteers. These volunteers are not being paid. And they're not being paid, and you really don't have control over them in the facilities. We want to completely overhaul that system. First, if you have a PIN code, you have to be there. You're paid by the government to do a job. And now we're looking at digital recruitment, such that it's not depending on who knows the minister or who's the minister's cousin. It's based on what you're capable of doing, what your qualifications are, what your experience is. We're going to aggressively move that forward. Again, when we go to sites, it's not just to look at the medical staff and what they're doing. We're looking at the society community that they serve to see how satisfied they are. On the finances, which is a major issue, we have free healthcare. Free healthcare is not for everybody. Again, free healthcare is not really free. Somebody has to pay for it. So the government is paying for pregnant women, lactating mothers, infants, vulnerable populations, people who recovered from Ebola. Those are the categories that fit into the free healthcare system. You and I, who don't fit into that free healthcare system, what you're looking at is a cost recovery program where you're given minimum charges to be able to ensure you get the services for an affordable cost. What we're trying to do now is to see, how do you pull the risk? Because you and I are sitting here today, we can all have malaria on the same day. But if we have this health ususu, health insurance scheme, where you could put money together, a small amount of money is put together, and what that does is ensuring that any one of us who gets sick at a particular time will have the resources to finance it. So again, it's free healthcare. It is a cost recovery program being joined together. What we want to do is to have a charter in each of the hospitals, so there's expectation. You go out there, if you're going to have a hernia operation, it cannot be free. Somebody has to buy the sutures. And the government is paying 11% of our whole budget goes into health. But the 11%, 75% of that money goes into staffing. So there's only about 25% that's going into the buildings, the drugs, the light, everything else that runs the place. So my role here now is to go find money, find partners, and bring it in. So I'm just saying, at the end of the year, what we're going to try to do is to consolidate our gains. As we go into the next year, we're going to focus on two major things. One is the human resource, the staffing that we have. We've made tremendous gains. We have more doctors trained. We have more specialists trained. We're building more hospitals for them to be able to provide high quality service. The second thing we're going to do is to ensure that we have the supply chain. The products, we're building a pharma grade warehouse here now, speaking about $10.5 million to build a pharma grade house, so that you cannot go and buy penicillin from everywhere and bring it and store it in a granary, in a store where you normally keep rice. It's going to be damaged in no time. We're building a high top grade pharma grade warehouse and establishing a supply chain that ensures that you're not only buying the products, you're not only supplying the products, but the products are actually reaching the intended users.
Right.
So we will do our part. The other part we'll need to do is active public education. Because if you go in there to say, for lactating mothers, it's free. You go out there, you say, Pastor, jump the line, Pastor, pay with income. Then you're contributing to the problem. So let us put it out there. Let's put a really broad charter. We are on a really important cost. Healthcare is on the verge of real transformation for this country.
Right.
But it will require everybody's role in it. The ministry has a role. Dr. Spencer, you have a role to play as well. But we could change this. We could change this to make it the healthcare that we want.
Right.
And it's not for Austin Denby. It's not for 2028. It's for a lifetime.
Right.
Okay.
Thank you so much, Doctor. Denby, briefly, Ernest, what will be your departing statements to us this morning? Your final comments, briefly, as we round off.
It's very unfortunate my mic is short.
Indeed, we apologize for that, actually.
My final appeal is for the public to actually see beyond politics in the fight against corruption. We have to really work on, our hospitals in the chain, as it goes in the aim of this year's global or international drug that speaks on breaking the chain, investing in prevention, treatment, and recovery, because we should be investing our arguments, our discourse, our energy in the way forward rather than, accusational conversations that who brought this, who allowed this to not. Because we should be honest to accept the truth that we are Sierra Leoneans, we have Sierra Leoneans selling drugs to Sierra Leoneans, and Sierra Leoneans are the ones dying, missing out on their future and their destiny. And who loses in all of this is the country as a whole. Now we are comparing our country to our nations or other developing countries in terms of global index, the NCC issues. But we shouldn't be on the spotlight for bad issues. Drugs for me is everywhere, just as Dr. Spencer already mentioned. America is having their own issue. Just that for us, it is a little bit embarrassing due to the lack of infrastructure because we are limited. This is all as a result of the post-war construction process that is ongoing because Rome was not built in the way, it was not laying the bricks to the greatness that we are looking for. Appealing to parents, teachers, stakeholders, religious sectors, politicians, even the professionals, we have to look beyond politics. Let us devise a universal or a unanimous approach to the fight against it, because at the end of the day, winning this fight is a Iranian victim, and we actually have the benefits of having a safe society that will be far from national instability, public health threats, or even something that will have to threaten our social security as a nation.
Honest, thank you so much indeed for being here. I want to thank you, Dr. Demi, for coming, and also Dr. Spencer. We appreciate indeed that you had shared your thoughts in that piece. And we do hope indeed that Dr. Dembi has learned one or two things actually. And you would inject into implementation next year.
Yeah.
Merry Christmas to you.
Thank you so much for being with us this morning. So this is where we end today's edition of the program Wake Up Sierra Leone. We say thank